Well, good afternoon, everybody. Thank you very much for making yourself available for this very important discussion today. My name's Jason Trethowan. I'm CEO for Headspace and living here in Geelong, usually working out of Melbourne, but pleased to be coming to you to this afternoon from my home here in Geelong. And I wanted to, first of all, before we kick off proceedings, just to acknowledge the land that we were on, the people of the Wadawurrung country, and pay respects to elders past, present and emerging. And I guess I'd also like to acknowledge too that coming here on behalf of Headspace and the Geelong Regional Library Corporation, just like to welcome you all to this event this afternoon. And also to a special thank you to Barwon Child, Youth and Family in helping to deliver this Libraries Change Life event. So my first thing I'd like to say before we get into the detail and introduce this fabulous panel that we've got assembled for you from this Zoom conversation that we'll have today, and we certainly will invite you to use the question and answer box there. You can ask questions. The way I'll roll with this is that I'll ask the participants, after I've introduced them, of course, ask the participants questions, and that will kick off proceedings, and then we're very happy to take questions from you, and we look forward to this being a very interactive session. And we'll go through to about 5:15. We'll look to try and wrap up at around 5:05 with some final comments, and we certainly look forward to hearing from you and thanking you for coming along today. Look, given that today's focus is on mental health here in Geelong, the community has an access to a range of services which are here for all members of the community. In addition to this, there are support lines like Lifeline and Beyond Blue, and they will be made available to you, and the contact details will be available to you in the chat function as well. I also wanted to just note that this is an environment that we're coming to you in relation to COVID-19, which is the context for youth mental health, and that's what has brought us all together in this environment. It's just another example, I think, of the importance of us all demonstrating the importance of connection, and that together as a community and here in Geelong, that we're all in this together in relation to learning all the time from the experiences of young people, particularly here in Geelong. It's an unusual situation. It's also, I just preface it by saying it's okay for us all to feel somewhat stressed at times, anxious, worried. Hopefully we're past the physical threat of the coronavirus. Obviously that's still yet to, obviously we're not over that completely yet, but compared to where we were 3 months ago, I think as a country and certainly here in Geelong, we've done extremely well to I guess overcome the threats that the virus certainly had, and certainly what we've seen played out in other parts of the world. So that doesn't mean, though, that the concerns for our health are over, because part of today's conversation is to talk about not so much the downsides, but also the upsides of how we can learn from this experience and focus in particular on mental health and, of course, also the importance of well-being. I think, too, that it's an unusual situation. It's okay for things to be disrupted, and we need to change our expectations about ourselves when we go through this period in terms of how we respond. And I think we've all learned a little bit about ourselves over the last couple of months, and certainly there is no one story that demonstrates every experience. We're all our own individuals living in our own family contexts, and certainly for our young people here in Geelong, we've either been perhaps disrupted with work, we've certainly been disrupted with study, we've lost some form of connection, whether that be through the sporting activities that we really like to do, or for those who gather in other forums, which brings that important social connection. And obviously, with all of that, it relies a little bit on how in which we respond as individuals, as families, and also as a community. And tonight, this afternoon, I should say, you'll hear from our panellists, which will help address some of those queries that perhaps you may have, and also ones that we've heard prior to this afternoon's event, which will actually inform our questions. So what I would like to do, though, before I introduce our panel, I'd like to introduce Grant Gibson, who is the Centre Manager for Headspace Geelong. And Grant and I thought that it was most appropriate that given the scenarios and situations that we've experienced as a community with relations to recent deaths of young people in Geelong, that Grant thought he would say a few words up front, and then we'll get on with the remainder of the program. So Grant, thank you and welcome.
Yeah, thank you, Jason. But probably the key thing that I did want to acknowledge is I know some of you listening in today will be aware that over the last few months there has been some really sad events in Geelong with a number of youth suicides happening in the early part of this year. We can see very clearly the significant impact that has right across the community. We're very aware of the grief and loss experienced by a lot of young people in our local community at the moment. We know that these issues have really touched our school community, our local Aboriginal community. There's a lot of people who have been impacted. So I mention that, I guess, just as an added part of the reality that we're living in. There has been a particularly tough time in Geelong. But I also mention it just to highlight why it's so important that we can have this focus that we're having today to really dig into the sorts of things as a community, as a family, as an individual, and as a service provider that we know are incredibly important to support young people's mental health. And Jason mentioned we're all in this together. We're all experiencing really unprecedented changes in the way our society is running at the moment, and all sorts of impacts. And it's really clear, it's like we've all been sent to this mental health boot camp to really sharpen up on our own personal strategies to help each other at a time when we need to be strong. The demands for us for support for our friends and family are also incredibly high. And I know for the mental health workforce, for people like Bryony and myself, Blake and Nicole that are in this space, and Jason, we do have some expertise, some special skills in the mental health space, and we're also being really tested. We're having to draw on all of our common sense strategies, all our supports to make sure that we can offer our very best support to the community as well. So tough time for all of us at the moment. And in that tough space, it's really clear that we can see much more visibly the sorts of things that work, that support our mental health, the things that we can do that make a really positive difference, the kind of assistance that our family and friends need. A lot of that often goes kind of on in the background and taken for granted a bit. But at the moment, there's a real spotlight on that. And there's some fantastic things being shared across the community. Really important learnings and reflections from our youth community, really important learnings coming out of our schools. Again, about the things that we know make a real difference that we need to be more disciplined about or practice more strongly. So I think our hope for today is that we can really focus some of those ideas and thinking for all of you who are joining in, and share what we know are the really key things that make an everyday difference for youth mental health. Incredibly important always, but especially important at the moment.
Grant, thank you so much for that acknowledgement of the context that we certainly didn't plan for this evening, but it was, thank you so much for providing those words. And also thank you to you and Headspace Geelong and the broader community, in particular the schools community, who have come together with our partner organisations locally, and will continue to do that. I guess it comes off the back now in terms of in 2020, the Libraries Change Live campaign, how that's been set up to focus on the social impact of public libraries in communities through the contribution to community and health and wellbeing. And I'd like to acknowledge that because I guess it's from the Libraries Change Lives campaign has what's brought us together this evening. So thank you very much, and that acknowledgement there. Okay, so now we've seen Grant, and thanks Grant, but I'm going to also now introduce our other three panellists I'm saying this evening because it's getting a bit dark, but I'll change between this evening and this afternoon. Nicole Scott, who's a 25-year-old here in Geelong studying social work, and Nicole's work is wide and varied, but a very passionate person when it comes to mental health for young people here in our community. Is a member of the Youth Future Crew, which supports Headspace Geelong, and is also one of 22 young Australians on the Headspace National Youth Reference Group. So doing some great work there. Thank you, Nicole. Look forward to hearing from you very soon. And also Dr. Bryony Roberts, who is a clinical psychologist at Headspace Geelong and has many years of experience in a whole range of different fields in mental health. And we look forward to hearing from Dr. Bryony Roberts, and also Blake Edwards, who is a mental health social worker. And Blake comes to us this evening in his capacity as the coordinator for youth development of the City of Greater Geelong. And also I noticed that Blake has also worked previously in Headspace, but actually through the Frankston Centre, so brings a range of different backgrounds. So thank you to Nicole, Grant, Bryony and Blake for joining us. So I guess in the spirit of things, we're going to kick off the questions, and I'd also encourage you to, along the way, to please post some questions in the chat, in the question and answer section on your Zoom as well. So first of all, Nicole, we're going to start off with you. I guess over the past few months, you've been sharing your experience about your mental health and wellbeing, and it would be a great way to start off today's discussion just to hear a little bit about your experience, obviously leading up to COVID, which we thought was not something that never really existed, and then obviously now, having lived through these past few months, perhaps share some of your experiences, and over to you. Thank you very much for joining us.
Yeah, thank you. So I would say every day has been very different. Some days I'll wake up and I'll feel pretty okay. You know, I'm studying at uni, so that gives me a lot of routine. But then there's other days where I just feel a lot of anxiety, a lot of uncertainty, can find it quite difficult to get out of bed and to do the things that I know I need to do to help maintain mental health. I think at the start, it was definitely a shock to the system to have to pretty much stop everything straight away. Uni went from being in class to online, which was quite challenging for me because we didn't actually have access to internet at home. And so there was definitely a lot of challenges, and it was really working out what I was doing to maintain my mental health before COVID and how I can adapt those things that I was doing to maintain mental health, and still continue to do them, but maybe in a slightly a different way, and really focus on being gentle with myself. And if I'm feeling extra anxious or just uncertain, to just really validate where I'm at and remember it's okay.
Thanks, Nicole. Thanks for sharing. Thanks for sharing that. The power of young people in this country and certainly in this community and sharing their experiences is quite profound and indeed needed, particularly in these times. But I'm going to move on with you, and Nicole, in terms of that. You've mentioned a little bit about uncertainty, and certainly in your examples, you've said that. But there's certainly been a lot of challenges in work and also study for young people in Geelong. And I'd just like to know, what are you sensing around that, and particularly around people who you may know and your networks around that work disruption, and they had a job, now don't, or underemployed when perhaps they were employed. And what are you hearing amongst your networks?
Yeah, I'm hearing that everyone has really gone through a whole heap of change, and I think people are really struggling with motivation and that sense of almost overwhelming uncertainty. And yeah, I've been hearing that a lot, and also a lot of loneliness coming up for people, and just trying to maintain mental health and routine.
So just on your routine, what was an example perhaps of something that you were practicing prior that would help you maintain your good mental health and well-being, or if you're not feeling so well, that the importance of a regular activity, and maybe where that was a little bit disrupted during COVID and how that challenged you?
Yeah, so I was going to the gym about 4 or 5 times a week, and obviously that wasn't allowed anymore. Gym's closed, and at the start I was like, oh, you know, this sucks. I don't know what I'm gonna do. And there was a while there where I wasn't exercising at all, and I was like, no, like this really helped me, and I can feel a difference in my mental health. And so now I make sure I go for a walk every single day, even if it's just around the block. Yeah, and make sure I get some of that exercise in.
Yeah, we might touch on exercise, the importance of that later on in some of the other questions. Thanks, Nicole. Grant, I guess throughout the discussion, we'll be talking about many issues relating to youth mental health, the role of services and opportunities for young people, family and friends to access them. Can you give a little brief overview, perhaps, of Headspace Geelong and how it is set up to support young people to access the service, but importantly to benefit from their experience in engaging Headspace Geelong?
Mm-hmm. Yes, so the Headspace Geelong service, there's a couple of different outlets that we operate from. The key centre that people locally will know in Yarra Street, the big green building in Yarra Street up from McDonald's. We've also got an outlet in Corio and services available on the Bellarine Peninsula too. So similar range of services available at each of those sites. And the model that we work from, again, is quite similar to the Headspace centres across the country. So if you've come from a different part of Australia and had a relationship with Headspace, you should be able to access really similar things from the Geelong centre. There's 4 key components, or 4 key areas that we understand if we take care of ourselves in these 4 areas, that we're going to experience greater mental health. So we organise our services around those 4 key pillars. One of those key things is primary health. We know it's really important. The condition of our physical health is really fundamental to experiencing good mental health. So we've got some resources to help us in that space, like GPs, community health nurses. There's a range of resources that really target young people's sexual health. All the normal suite of GP services that you can access in the general community. One of the differences that we like to think happens with the GP services here is that our doctors are particularly tuned into the needs of young people, and they understand that the things that are really relevant to that stage of life. And I guess they're expert in their GP practice, and also have that broad understanding of what helps good mental health for young people. Alongside the primary care pillar or service model, we've got services to support young people with drug and alcohol challenges. So we've got a specific program that supports young people who are experiencing challenges related to drug and alcohol misuse. Again, we know there's a really close relationship between our mental health and physical health and the choices that we make in relation to the use of drug and alcohol. So there's a counselling team that provides psychoeducation and assistance to support people with their goals. They adopt an approach that's very client-led, that really aims just to help young people to be clear about their goals and support them in that journey. The third pillar is for youth mental health counselling. So I guess this is the more specialist stream that really hones in on the specific issues that you might be dealing with in relation to your mental health. And Dr. Bryony Roberts will talk to that in a minute. She's part of that team. Again, the approach that the counselling team take is really determined by your individual needs. There's a range of resources that our clinicians can offer to provide good psychoeducation, to share all of the resources that are available across the community about the things that we know constitute good mental health. We also know that everyone's experience is completely unique, and it's really important that young people have a chance to talk to their specific challenges, to tap into their own individual strengths. like to think that our counsellors help people to identify the things that they're good at, to identify the things that promote their mental health, and to make some plans around any things they're involved with, whether they're relationships or habits that might be detrimental to their mental health. And we help young people make choices about taking action around those, making those sort of changes. There's a range of different treatment methodologies or approaches to that support that we offer. I won't talk detail. I might leave that to Bryony. The fourth key pillar, or the fourth really important service area that we know impacts on all of our mental health, but particularly young people, is relates to your participation in school and employment opportunities. So we've got a specific service that helps young people who might be disengaged from school or struggling to get by in a mainstream schooling environment. They might need some support around their mental health to get prepared for returning to work or working with an employment agency. Really specific focus in that area. All those services are offered in the centre. We've got a range of other partner agencies that work from the centre here too. Which includes services like Canteen, the Centre Against Sexual Assault, that have visiting workers that come here to try and make their access to their services as easy as possible. So broad range of services. What we offer really depends on every individual's needs and the particular goals that you have that you want to work on when you come to the centre.
Thanks very much, Grant, for that overview. Bryony, I guess as a starter, you're a clinical psychologist. Why work with young people? What brings you to Headspace? And there's lots of challenges, as Grant's already said, and Nicole's outlined. I'd love to hear from you about what brings you to work with young people.
I think that what kind of inspired me to work with young people is probably my kind of interest in sense of self issues, because adolescence is such a big time for the development and emergence of self and identity, and my interest in the area of psychological wellbeing and resilience, and knowing that if we can start to plant those seeds of positive mental health and the skills to maintain mental health over our lifetime at that early stage, we can often head off some of the issues that might occur in an individual's life, or give them the skills to mean that they know how to manage future episodes earlier on and kind of avert some of those more severe experiences that can occur for people. So it's sort of like the planting of seeds at that stage is what appeals to me about working with young people.
So young people will come to Headspace and to see you for a whole range of matters. It could be, transitioning from school into different work and study options outside of secondary school. That is, it might be relationship breakdowns. Obviously, a large number of people will come around anxiety and depression. But everyone's an individual. So how do you, I guess, approach, working with young people in the clinical context, but also in their context as an individual in Geelong?
Yeah, I do think it's really important that we don't just think about the people that come to see us as defined by their problems. They are a whole person. Whether they've got anxiety, depression, or something else going on for them doesn't define who they are. And I really think it's very important that we don't lose sight of that. So we always, I think, at Headspace are very good at maintaining that person-centered approach and really letting the young person lead in terms of setting their own goals and working with what their priorities are, rather than us imposing our own kind of agenda on them.
I guess too, when it comes to understanding, helping young people understand what does good look like, what does good mental health and wellbeing look like. Obviously, most of us from the outside would go, oh, well, they're, our mental health and wellbeing is about being strong mentally and so forth. But there must be other things that you talk about, like nutrition. You heard Nicole talk about the importance of exercise, and you mentioned before about handling the tough times so that they can use that toolkit later in life. How do you explain what does good mental health and wellbeing look like for a young person?
I think good mental health and wellbeing is a really holistic kind of topic. It includes things like having a really balanced routine, and that might include a good sleep-wake cycle, so fairly regular times that you go to bed and wake up, that you're getting restorative sleep during the night as well is really important, and that we look at how you're going to sleep if that's not occurring. That someone is eating regularly, having pretty balanced meals, that their routine includes some personally meaningful activities. So whatever it is that brings them joy, that creates a meaningful structure in their life, it's really important that young people have those things, and that all of us have those kind of things going on for us. And I think that we have downtime within our structures to include that is really important. Social connectedness is another aspect that's really important in terms of good mental health. The ability to kind of communicate and express yourself and ask for help if you need it is also something I think about when I think of good mental health. And knowing that you've got some strengths, and knowing that you have capacity and resources within you. So that positive self-identity is also something that I would put under the banner of good mental health, and knowing that you've got some skills there to ride out patches of stress and mood fluctuations, which are part of all of our lives. So knowing that you've got some resources that you can draw on, I think, is also an aspect of really good mental health.
And just a final one before I ask Blake a couple of questions. We'll have some parents who are with us tonight. Talk to me about the role of families and the importance of families when it comes to young people and their mental health and wellbeing, and how you approach that.
Yeah, well, families are the context which we often exist in, so they've got a really fundamental role in mental health, and if things are working well, there can be a really supportive function around that particular individual. Sometimes things can get a little bit challenging in families too. We've got lots of personalities and lots of things going on, and I know the COVID period has probably tested some family structures out. In terms of good mental health, I think for young people, they need to know that they're safe in coming to you, in being able to communicate with you, that there is that open door of communication is a really important thing, that there's times of connectedness with our family that are positive, and especially with coronavirus, that don't involve what's been going on in the world at the moment, that we can carve out some pockets to just connect with each other, to make sure that we're checking in with each other's needs, especially at this time where we're all being tested, where some families might have financial pressures as well as worries about the virus situation going on.
Thanks, Bronnie. I'll give you a rest, but I'll come back to you, don't worry. Thanks very much for that. Blake, so I guess I'm interested about hearing from you about the role local government plays, especially in the area of providing access to community infrastructure for connecting people to sport and physical activities, and what do you see as the link to this in that role of local government and younger people's mental health and wellbeing?
Yeah, good question, Jason. Thanks. I suspected something like this was going to come up, and then when Nicole talked about gyms getting shut down and councils being responsible for running them, I thought I was in the firing line for a second there. Just to reassure everyone, that was a COVID-19 decision, not mine, so don't come at me. So the city play a really important role in enabling access for young people and all community members to a range of facilities. So gyms, pools, community centres, leisure centres. So a really big focus on community activity and physical activity is a focus of the work that we do. And I think if you're looking at some of Headspace's materials, those 7 tips for a healthy headspace, it talks about getting active as being really important for good mental health and wellbeing. So my team put a really big effort in ensuring young people have the facilities and the programs available to them for free to stay active and keep active. And I think that despite going for a big run or doing some exercise and being a bit exhausted at the end of it, you do feel really good, and it helps wake you up and keep you going. And those endorphins and all of those good chemicals that are produced from activity is really key. So the city, like I said, they provide social infrastructure for everyone, but specifically for young people, we've got drop-in centres across the region. So we've got the Fort Youth Centre, which is a youth-specific space, and then there's 6 others across the region. So Armstrong Creek, Leopold, Grovedale, Whittington, and in central Geelong. And in those drop-in centres, there's a big emphasis on activity and connection and engaging with other young people. So the city play a big role.
Yeah, it certainly does. It certainly does. I guess just on your reflection about what have you, obviously you just mentioned a lot about young people and now COVID context. I mean, moving away, I guess, from the exercise bit, but in terms of what's your sense based on your engagement with young people and the networks that engage young people? What's your sense about how young people in Geelong are dealing and managing in the COVID-19 context?
Yeah, so we obviously see a lot of young people. So 2,000 programs each year we run, and about 30,000 participants in those programs. And the young people who have been engaging with us have been talking, I think, in a really different way to what adults probably do. I think a lot of them have been focusing on the good things that have come out of COVID-19, those opportunities to stop and reset and rethink about how things are going, just slow down a little bit. I think that, like everyone, young people have probably had enough of Zoom and had enough of sitting in front of screens. So that screen fatigue for adults that we're feeling are absolutely, I think, being felt by young people. They're really keen to get back to those face-to-face conversations. But I think overall, young people are doing a really remarkable job, and I don't think we've given them probably enough credit for how well they've managed and how great a job they're doing in a really trying time.
I couldn't agree more. Often in young people are talked about issues in young people, but gee, there's so many inspiring young people, so many leaders in our community, and forget the words of leaders of tomorrow, they're leaders of today. And I guess sort of moving on from that a little bit too is that we've mentioned a fair bit. I think everyone's mentioned engagement, and Bryony spoke about the importance of social connection, doing things you like and doing them often. What have you seen as your experience as to how to, and motivation was mentioned before too, but how do you, maybe rather than how do you see young people based on your experience about what brings them to do that engagement, and not just with any particular activity, but just in general, and how do they find that hobby and how do they find those passions in life, and what have you seen from your time in working with young people?
Just so much diversity. I think that every young person's got their own unique set of skills and their own unique view on life and picture on the world. And I think that each individual young person brings just a wonderful amount of different ideas and energy to a space. So Geelong Youth Council Geelong established a youth council this year or last year. And the young people who are involved in that have just been an absolute shining light for the city, and they've challenged the ideas that Geelong have had around what it should be doing and what it could be doing, and really starting to push forward with positive attitudes and ideas. And it's really lovely to see each one of those young people being given the opportunity to have on say on matters of importance. So I think that too often we probably focus on the less good things about young people. You get media reports about young people have done this and young people have done that, where in reality there's so much wonderful stuff that they've been up to and are contributing to. And I think one of the ways that the Geelong City Council are looking at celebrating that is through youth awards. So Geelong Youth Awards are open at the moment. There's a whole bunch of topics and things that you can nominate young people for. There's a $1,000 prize for each individual young person who are awarded. And I think it's a really great way to start recognising the wonderful stuff that young people are doing, because they're a breath of fresh air. Jason, you're spot on. They're not the leaders of tomorrow, they're the leaders of today, and we should start listening to them a little bit more.
Good on you, Blake. We'll come back to you in a moment. Thanks very much for that. Nicole, you might recall that Headspace, in a survey not so long ago, of 4,000 young people actually said that 62% of young Australians said that the mental health of young people in Australia is getting worse. And they said 37% of that, the highest response was around social media. And so instantly, some people can just automatically say social media is bad, we shouldn't have it, things are best if we didn't have it. can you just maybe give us your view? And I know you're pretty strong about this, so I'm really happy to hear it full throttle, because it's from your perspective and also the young people that you network with, and I've heard it myself around the country. Tell us a little bit about that social media context and maybe some of the ups and some of the downsides, obviously, as well.
Yeah, absolutely. So yeah, I think people are very quick to see social media as a negative, and there are definitely some more negative aspects to it. However, I personally have found social media an extremely empowering space, and a space that actually helps me so much feel so much more purpose and meaning. There are so many groups, and it's so easy to even create a group yourself to connect with people who have the same interests as you, have similar skills, and it can be a really empowering space. And it's a great space as well, especially I have found Instagram, to look up people who you look up to and to follow them, see how they're doing, see what they're doing in their lives. And it can be a really, really empowering space for young people. And it can be a really encouraging space and a really connected space as well. Yeah.
So, I mean, I guess I experienced it myself, even at the start of the year with bushfires. It seems a long time ago, doesn't it? But it was just only a few months ago that we were all devastated by what was going on here in Australia, and really found the volume of information that you're getting. And perhaps I wasn't looking at quality, I was mainly quantity in terms of that. So having to even just myself to turn away. Do you want to just maybe talk a little bit about that quality of, so you've spoken some of the positives around social media, but maybe around that quality versus quantity, which I think is an important one to get through.
Yeah, absolutely. I think it's really important to realize what information you're taking in and how it's affecting you, how you're feeling about it, and to be able to take a break if you need. Make sure that the information that you're taking in is what I have found personally is from the right resources, and is actually more on the minimal side. I found that it's really important to see how you're feeling when you're taking in that information and how much you're taking in. And also I found what time of day you're taking in that information can really affect how people are feeling as well.
Bryony, just as a follow-on to the social media, so obviously body image has become a major issue when it comes to overexposure of in social media. So taking Nicole's points, and maybe putting it into some of the challenges of some of the downsides, I guess, of social media. But how do you approach some of those challenges that you see with young people and families coming forward? And I mentioned body image is one example. Perhaps you've got others as well.
Yeah, I just want to say that I really like Nicole's points on both sides. I think one of the big things is that check-in with how things are landing with you, and whether it is supporting your health and well-being, and whether it's not, and being curious about your responses and then adjusting what you do in response to that. I think the body image stuff is one of the things that comes up frequently in my client population at Headspace, and it's often around that social comparison. And I think the self-presentation that people do on social media of putting their best selves out there, and you don't know if there's a filter on what you're looking at too. And so what I often see is people comparing themselves against someone else's highlight reel, possibly with a bit of filtering and editing added onto it. And they're comparing their real life against that highlight reel, but when they do that, they're not actually recognizing that that's what they're doing. So it is sort of peeling back the layers and recognizing that that isn't a true representation of that person's life, or not necessarily of their shape and body as well. And I guess one of the things that I have sometimes suggested to people is perhaps thinking about who you do actually follow on social media and perhaps unfollowing some of the people that tend to trigger you in that sense. So really monitoring how you're responding to things and whether it's feeding into some of the presenting challenges that they might have, especially if that body image, for instance, is an area that they struggle with. They might choose to unfollow things that don't support their progress in that area and to perhaps follow things that are more empowering, like Nicole suggested.
Thank you. I just, as a follow-on too, around moving slightly away from the social media element, but as we said before about anxiety and depression, we talk about that. You're right before you said it as labels. Young people come into services, I guess we all do, doesn't, irrespective of what age, with your own feelings, and then obviously through that there's a diagnosis process, and for people in Headspace, a lot of them are coming eventually with a diagnosis of anxiety and depression, and it's the most common reasons why young people are coming to services, youth mental health services. So we hear about these words, anxiety and depression, but when you've got someone in front of you, what do you do? Like, what does a clinician do when it actually, such a big moment of sitting in front of a clinician in Headspace, Geelong or elsewhere, and there's an expectation of or an awkwardness, I guess, from the client, wondering where this is going to go. I'd love to hear from you about how do you now personalise it, and how do you engage, and what's that like from the clinician point of view, looking back at someone who's so brave to be sitting in front of you?
It is really brave, and it's often a really big step. And I've been in the shoes of that person too, having visited psychologists at different points. So I understand how critical those engagements are and how vulnerable you can feel stepping into that space. I think from our point of view, it's really about relationship building to start with. So treatment is a secondary thing, and what we might do for that is a secondary thing, but it's really about meeting that person where they're at and getting to know who they are and getting to know what they would like their life to be and what isn't working for them at this moment in time. And often it's the symptoms of anxiety and depression that are getting in the way of what they would like to see showing up in their life. So really starting to frame treatment around how would you like your life to be, what's not working for you because of what's going on at the moment. So letting their vision for where they'd like to get to be the guide. So it's always about what can we do to remove the barriers for you so that you can get to where you want to be. And often that is then looking at some of the symptoms that do tend to get in the way of us living how we'd like to live. So it might be looking at our thinking patterns and how unhelpful thoughts get in the way and how they affect our mood, and then looking at how we can change our response to our thoughts. So we often don't have to get rid of the thought, but how we can change our response to it so that it doesn't get in our way. And then looking at how we work with feelings and looking at how we can learn to sit with uncomfortable feelings and work with uncomfortable feelings so we can still get on and do the things that we want to do. So with anxiety, so we don't have to continue to avoid the things that make us anxious, so we can build those skills to get back to doing things. And the behavioural aspect is a big part of depression and anxiety treatment too. So that is about what you might not be doing anymore because of the symptoms, and how do we get you back to doing the things that you love? How do we get you back to yourself again? Which is, I guess, the ultimate goal is to get them back to themselves and back into meaningful activities and back into the lives that they would like to be living.
Thanks, Bronnie. Now, Blake, I'm going to ask you in the context. So we've just spoken about, and maybe I did this in the reverse order in a way. We've just spoken about the young person who has either been brought in there by their parents who are concerned, schools refer them in, a GP referral, or they've actually walked in themselves. But often it's all the work that's done in the community. And I want to touch on the word stigma. And how much of a barrier do you see that being in our community today, in people accessing Well, there's two, I guess there's a number of layers of stigma, isn't there? There's one about me realising it, one talking about it to a mate or someone close to me, and then if indeed I do need professional supports, there's another step forward. So in the community space, and your experience obviously in prior roles as well, tell us a little bit about engagement and what do you see in stigma and how you overcome that and some of the work that you've been involved in.
Yeah, so I think you're right. There's different types of stigma, that conscious and unconscious stigma that exists in the world that we live in. We're really big on mental health promotion and talking about mental health. And I think we were chatting yesterday, and might have been with Nicole talking about treating mental health just like you treat physical health, and having those conversations that, you know, if you break your leg, you go and get help. You go and ask for help. You don't just lay on the ground and try and get up and get on and just go and do it. You go and access the people that can help out. And we very much take that same approach at the city. So we're running mental health first aid programs across Geelong. I think since 2019, we've delivered about 120 programs across Geelong to just over 3,000 people. And that program really does focus on helping people recognise that mental health is something that everyone has, that everyone in the world experiences mental health and different feelings within it. And there's times where you're doing really well and there's times where you're doing less well, and it's okay to talk about it. It's okay to ask for help. So that mental health first aid program really teaches people to recognise emerging signs that you may be not doing so well, and how to assist someone in accessing the services that are out there to help out, like Headspace.
I might add, Grant, in terms of engagement of young people, and I guess the work that we do in the community, I guess, in addition to what Blake said around addressing stigma and the importance of that, because it's one thing to create awareness of mental health issues. There's one thing to create the confidence to talk about it. But often there's many people, and I'm sure I'm not alone, where I've been called and someone's worried about someone and they want advice on what to do next and where to go. And we don't quite have it right in mental health compared to in physical health. I mean, that's a fact. We're on the catch-up path, I guess. But give us a bit of an insight about going from that awareness to that help seeking, and then actually creating that safe narrative. And I say safety, that can be culturally as well as being good for young people to go to, into actually going into services. And actually even the service experience will either be a great reason never to go back again, or actually maybe a good enough reason I might come back again. Can you give us a bit of an idea about what you see in your experiences of that?
It's a really important question, because we know that young people seeking help for the first time, the way they experience their first contact with professionals is super important to their confidence in making use of our services and following through. So look, I think what we know is that again, it needs to be different for different young people. There's no one set kind of recipe that works for everyone. What we try to do really hard is just to make sure we can explain who we are, what we do, the processes we use, who we would talk to, our relationships with family. We try really hard to take the mystery out of the work, but by just giving good information about all of the different things that happen if you're in contact with a service like ours, provide good information to young people, and offer it again. Again, really important we can keep that info available and recheck back with young people a few weeks down the track. Often when you first present for help, it's really hard to take in a whole heap of complex information about what services do. So we focus on just trying to keep it pretty simple, checking understandings, making sure young people and families know that if they've got concerns about what we're doing, they talk about it. So we give opportunity just to check in and make sure there's nothing that's creating anxiety or uncertainty. So I think we also know that there's a pretty tried and tested recipe for all of us, that we learn best when we're having fun, when we feel safe and confident and valued, that we will take on new things and we will learn as effectively as we can. So even though our mental health is something we put a lot of importance on, and in a lot of ways it's pretty serious territory, we know that it's important that we can make it a bit of a playful space as well, and find ways to make sure we're not being overly judgmental, being hard on ourselves, give that permission for young people and families as well, to not be perfect on any front. I do think, Bryony mentioned this before, that one of the really key things is to make sure that we can see each individual and understand their values and what's important to them. The importance of the relationship, seeing each person as unique. So we ask lots of questions. We just keep ferreting away until we can find those things that each young person finds meaningful, finds valuable, to find a way that taps into their learning style. Young people, with all of us at any age for that matter, we've all got different ways that we learn. Some people like to hear things, some people need to see things, some people need to do things. So it's on the professionals, I think, to find out what it is for each young person that gives them the greatest chance to learn new skills, take in new info, and to pitch what we do in a way that works for them. So a lot of checking.
Yeah. I was once told that the top 5 key things to do when working with young people is engagement, and then engagement.
Then do it again.
And then again. Yeah. Now, hey, we're in COVID now, so you kind of explained an ideal experience of people, safely walking through the streets and heading into Headspace Geelong, and you guys at the front desk, beautiful people there engaging and making young people feel comfortable. But we're in COVID now, and now for all of us, if we want to go to the doctor, it's not possibly the same. It's a telephone call, it's telehealth, or it may well still be face-to-face in a number of clinics. Headspace Geelong is an example of where you've switched over to telehealth and phone-based services. And I ask this question because we've spoken about the importance of family and parents' engagement, and that's the context, as Bryony said, and an important part of the team really is in terms of helping out with a young person's mental health and wellbeing. One of our recent surveys across the country with Headspace was that of those who have used telehealth services, 40% said it was great because mum and dad didn't know about it. I could do it without, they didn't know that I was leaving home to access a service. And on one hand, I thought, oh, maybe that's not so good from a family point of view, but actually it offered a different choice for at least a young person to engage on their terms, and that word engagement came up again. I'd be interested to hear what your experiences are, and we'll go to Nicole, and if she's hearing from her fellow colleagues around the experiences of telephone and telehealth as a way of delivering services.
Just quickly, what we're learning from young people who are giving their feedback and from our clinicians is there's been some real advantage for having some new ways to connect with young people that's a little bit safe, perhaps a little bit less confronting, can be in the comfort of their own home, on their own turf. So yeah, there's been some real pluses. There's some young people that have expressed the downside, that are really missing the face-to-face contact and that closer connection. Likewise for our clinicians, they're finding some of that a little bit challenging. That we worry that we might miss certain things if we're not sitting with people in person. So learning about all the extra questions that we have to ask and the extra checking that we need to do, just to make sure we've got a really clear picture. But look, lots of really good learnings. There's a whole range of things that we've put in place in this time that we really hope we can continue, that we want to continue into the future. Some of that's to be able to reach out to young people further away from the centre as well, that might live in Bannockburn or Lara or near Colac, and they just can't make it in. So it's extended our reach in a lot of different ways, and maybe given young people a little bit more control over how they make use of us and how they relate to us.
Nicole, what have you heard along in conversations around the fact that we've had to almost overnight flip the model from being purely typically in person, but also now telehealth and telephone, and that engagement and experience of young people?
Yeah, I think it's been a really big change for everyone, and a lot of uncertainty. I think the key though is giving young people a bit more choice and a bit more flexibility. I think it's really awesome that you know, some young people can do it just from their home, and that's something that they're really liking. They don't have to go out. From a personal perspective, it was definitely challenging, and I did consider waiting to see my psychologist, but then I realized, no, this is something that I really need to maintain my health. And uncertain things, you know, it's only uncertain for a little while because I haven't experienced it. And then after that, you know, you start to get a little more comfortable with seeing your own face and yourself talking and that kind of thing. So, yeah.
Yeah. Thank you. Thanks very much. I'm going to, Bryony, I'm going to just a question from the Q&A area about, I feel like I'm losing my friends. It's making me feel more shut off to everything when I talk to my friends. How can I stop this feeling? So it's around about that COVID context and friendships and feelings around that.
Yeah, it's such a, I think the first thing is just acknowledging for yourself that this is a tough experience, that the change has been tough for you. I think we can never undervalue the importance of self-compassion and acknowledging when we're having our tough moments and acknowledging that that's normal. I imagine that there are probably a lot of people who are experiencing some sense of disconnection and grief associated with that, with the changes that are occurring at the moment. I guess I'd encourage you to have a look at if there are any creative ways that you could reach out to your friends or reach out to different people if those friends aren't wanting to engage at this time, and to perhaps look at other ways of staying connected in the world. It is an important thing to acknowledge the feelings that you're having, and to name them can be a really helpful thing. So to name what it is that you're feeling about that sense of disconnection, and to allow some space for that feeling, to know that it's normal. Whatever feelings we have, they're normal, and they typically will come in kind of like a bell curve, where the peak of them will be the most difficult part. And sometimes we need to do lots of self-care strategies to get through that peak, but they'll always come down again. So a bit like a wave. So knowing it's a temporary thing that you're experiencing in terms of the feeling, looking at your own self-soothing strategies for getting through that feeling. So the things that calm you, the things that make you feel well. So they're very individual. They're often kind of sensory-based things. So for me, it might be walking and yoga and meditation. For you, it might be really different kind of things. So just kind of tuning into what it is that helps to soothe you as well. And checking in with other supports if you need further help in terms of managing those feelings and that sense of disconnection. So reaching out to services like us, we can definitely help to teach you skills for working with feelings and working through what you're going through. And knowing this is temporary, I think, is part of it too, that COVID seems to be resolving for us, and that hopefully life will gradually return to normal. But at the moment we're in a transition phase, and transition phases are often pretty icky and strange, and it can, just knowing that it'll pass, but we're in like a normal transition phase where we can see normal or a COVID normal coming, but we're not quite there yet. But things are changing slowly.
I noticed that, I'm not sure if I mentioned earlier, but one of the main reasons young people were coming into, say, our online services, so through web chats and email discussions with mental health clinicians, was the sense of feeling overwhelmed. How do you see through that? Like, how do you get through that feeling of being overwhelmed day in, day out, where nothing much is changing? You're still isolated. Maybe we're allowed out a little bit more, obviously, but there's still that, I've heard from young people, there's still that fear of going out. And they may have started something, they may have just started a job prior to COVID, they may have just started first year university prior to COVID, may have just started year 12 prior to COVID. And there's a sense of feeling overwhelmed. Maybe some advice around that, Bryony.
Yeah, sure. I reckon that comes up and down, doesn't it? And like Nicole said, things are different on different days for all of us at the moment. And I know that I'm no different in that sense, in that things can be up and down in terms of how you're responding to the situation. I think coming back to today can be really important. So really trying not to let our minds get too far into the future, not to go too far back into the past and hang on to how it was and I want it to be back like that. So really trying to ground ourselves in the here and now as much as we can. So noticing when our minds have wandered into the past or the future and coming back to today. And yes, you might have some challenging stuff coming up today, and I think it's about stripping it back and thinking about, okay, what do I need most right now? And if you're feeling overwhelmed, probably what you need the most is grounding kind of techniques. So things like being in nature, things like having a simple routine, engaging your stress management techniques. So peeling back some of the layers of expectation on yourself, things like healthy eating, those kind of things, and back to self-soothing. So whatever calms you and soothes you, using your senses can be really important stuff. And I think probably disengaging as much as you can from news and media and anything triggering in terms of social media is a really important thing to do, because there is so much that can keep us in that perpetual stress response in the news coverage and things like that. So trying to come back to a normal, maybe picking a focus of something that's simple that you can manage, or something that's enjoyable that you can manage, and having that as your daily focus, even if you're also doing other things.
Thanks, Bridie. Blake, and then maybe Nicole, just on this one. Bridie mentioned expectations. Prior to COVID, for many young people, meeting expectations of others was I guess, a contributing factor to their mental health and well-being, and at times in a negative way. Expectations of young people now, I guess, are what? Compared to prior to COVID, like what if they had? People will have aspirations to do something and move to the next day and the next day, and might be study, might be work, might be sport, might be activities. Those expectations, how do they reshape them, I guess, now, or is there a need to? Do we just admit that COVID's a context and we move on? Interested in your thoughts around expectations in COVID.
Yeah, good question. I think expectations have been something that are almost shifting on a daily basis. You know, like everything's changing so fast at the moment, and you wake up one day and you think this is the way that it's going to fly, and then something changes really quickly. I think probably the thing to remember is that we're all in this together. Like everyone's going through the same thing at the same time, and our expectations probably need to be agile. And I think a lot of young people's expectations are that at some stage we're going to go back to normal. But every time you go through a period of change, so when the change came from being in the open space into lockdown, it was scary, it was anxiety provoking, it was big. And then when we're talking about maybe these restrictions changing again, those levels of anxiety have gone up again for a lot of people, and they're feeling uncomfortable again. I think it's really important to be okay with that that discomfort and ride through the discomfort, and always check in. And like I said before, we're in it together. If people are feeling disconnected, it's really likely that other people around them are feeling the exact same thing. So check in with your friends. You start to see things really differently, I think, when you're under pressure and under stress and feeling down, and it changes the whole way that you think and feel about things. But it's probably not as bad as you think that it is, and it's highly likely that the person sitting next to you is feeling the exact same thing. So expectations, they'll change. The expectations that we have on the community are that we get back to normal as soon as we possibly can, and that normal is going to look a little bit different, and it's going to feel a little bit different, but it's okay. And I think that it's now's the time to start thinking about, hey, what are the things that we've really liked about this time? Because there's going to be a lot of less good stuff about what's happened during COVID, but there's going to be some little gold nuggets. So I think it's starting to hold on to those and starting to write some of those things down about things you want to keep. Yeah, expectations, they're a tricky one. They're forever changing, and it's a really interesting place to be at the moment.
Nicole, you got some views on expectations?
Yeah, I do.
I thought you might.
I think it's most important to address the expectations that we have on ourselves. I don't know about anyone else, but I can be the hardest critic on myself and have very high expectations for myself. So I think it's really important for people to realize we are in a very unknown time, a very different time. And it's really important to try and not have those really big expectations on yourself, and to also remember like your productivity doesn't equal your worth. You don't need to be achieving all these amazing things right now. Just you getting through the day is massive, and that needs to be our main focus, is just trying to stay as much connected as we can, to do the things that soothe us and help us create that certainty within ourselves, and to remember to really be gentle with ourselves. I think that for me and for some people I know, this has been a really great time to reflect and think about what is important to us, what help keeps us healthy, and also when we go into whatever the new normal is, how we can continue these things. And I think even when we do go into whatever the new normal will be, to remember that, you know, we are all trying our best, and that's good enough. And to just on what keeps us healthy, what keeps us feeling okay, and to continue doing those things, and to really validate ourselves with where we're at, and wherever we're at, it's okay.
Great, thanks. That's awesome feedback. Love it. Thank you so much for sharing that. I'm now going to ask each of the panelists. I'm going to start with Blake, then Bryony, Grant, and we started with Nicole. We're going to end with Nicole. Just any final observations as you're being part of this conversation, but also listening to others this evening, I guess it nearly is. How have you, what's some of your reflections and maybe final messages if you like to? So I'll start with you, Blake.
Yeah, final kind of reflections, I guess that you know, we all need to be agile at the moment. We all need to be on our toes, and we all need to be able to make the changes that are coming our way. Like that whole idea of sort of going with the flow and rolling down that river as the things sort of take us down there is probably what we need to focus on. I think make sure that you're helping yourself, look after yourself, and keep your eye on your friends and your family and your neighbours. I think like the really big challenge that we've had is that the message since day one has been, you know, socially distance, and I think that they got it wrong. I think that we probably need to focus on spatial distance and remain socially connected. So let's make sure that we keep connecting with our friends and keep connecting with our peer workers and our community, and remain spatially distant, not socially distant.
Thanks, Blake. Bryony.
I think my final reflection is just around stigma and shame. And I think the thing that I'd just like to say is that we are all human, and every single one of us will face mental health challenges of one sort or another at some point in our lives. I absolutely believe that none of us will be left untouched. And in that sense, we are all in this together in terms of mental health, and there is no shame in coming forward with a problem. We're all human, and the fact that you might have something going on for you is just a reflection of that human experience.
Thanks, Bryony. Thanks as well with Blake. Thank you for your awesome contributions tonight. So, Grant, I'm going to ask you for your reflections and any final words of wisdom.
Yeah, look, lots of really great perspectives shared today. I think for me, it's about catching the learning. It has been a time of really important learning for everyone in the community, just around what we need to do collectively, how we back each other, how we look out for each other, and what we need to keep our mental health buoyant, how we remain hopeful in the face of some really challenging times. So it's not the kind of opportunity you'd book in advance to sign up for, but the reality is we're in it, and the learning and growth opportunities have been really awesome. So for me, it's about catching that, identifying those things that we can that we want to take forward into the future. Managing expectations. I think that the keep it simple mantra is really important to stick with. Don't get too caught up in history or worry about the future. Focus on the day is super important. But probably the last thing for me, and it's a bit of a shout out to young people in the community that may view themselves as struggling with mental health challenges at the moment. As in any way that you can, to share your experience, I think is super important, because you're the people that we can all learn from. You're the ones that are already in that experience, with lots of wisdom to share. We've seen great examples of that today, and find a way that's comfortable for you to share what you're doing to manage in this environment, because other people will gain from you sharing your experience.
Grant, I'm going to just ask a few seconds to answer these questions. It was one that came up earlier that I should have got to, but if you're not feeling okay but not ready to talk to family, what can I do? And I think part of that is you can talk to someone else who's close to you and connected to you, and someone you trust, and have a conversation. And then the question is, can I go to Headspace without my family knowing? Is the first one. Do you want to?
Short answer to that is
Yep.
Is yes, absolutely. And also, Headspace is obviously available for people if it's difficult to get to a centre and you want to reach out, you can do that online. So absolutely, that's possible. It's important that you know that we really value the role of parents and family too. So we do want them included. We will talk to young people about how we can make that connection to get their support. And we'll do that as best we can in a planned and safe way. It's really straightforward if you're over 16. If you're under 16, it gets a little bit more complicated, but there's always a pathway to work through that. And we'll be relying on that young person to help us figure out a safe way to share the maximum possible info that we can with parents at the earliest possible time.
Okay. Do I need to go to the doctor first?
No.
Can I just walk in to arrange to talk to someone?
You can. Yep.
Beautiful.
It's difficult at the moment because we're pretty much in lockdown. We've got one day where the clinic's open at the moment. That'll start to open up. So at the moment, you do need to call because you might get a closed door if you walk in. But we're hoping that won't go on for too much longer. And absolutely, it's okay just to walk in. Sometimes it's a bit easier and we're a bit more organised when you phone in advance, but if walking in is what you need to do, absolutely, we're here for that too. Thanks
heaps. Okay, Nicole, thanks heaps, Grant, and appreciate everything you're doing and your team at Headspace Geelong. Nicole, started with you, going to finish with you. Final observations perhaps, and any words of wisdom.
Yeah, I think it's just really important for people to understand whatever they're feeling, whatever they're thinking, it's okay where you're at, and to just remember that, that there's no bad or good emotions. They're just all, part of the human experience. And it's so important to reach out for support if you need that, and to check on the people who are around you and in your community. And this will be over before we know it. And just everyone look after themselves and be gentle with yourselves.
Very good words. Thank you so much, Nicole. Thanks for your contribution today. I'm going to finish this panel discussion. Thank you very much to all panellists, Nicole, Grant, Bryony and Blake. Thanks also to Kim Edgar, who was really cool behind the scenes helping us organise today, and also many of the team at at Geelong Regional Libraries. And so I wanted to acknowledge them, and also in particular the role that the 2020 Libraries Change Lives campaign, and how this is all an example of being a part of that. In the event that this discussion has triggered any emotions or thoughts about your own mental health and wellbeing, please reach out to services that we've put into the chat room, but also please reach out to organisations like Lifeline and Beyond Blue. Very easy to surf the net and find those details really, really easily. And of course, if you yourself are a young person here today, and this is maybe one of the steps that you may need to take, if you talked with friends and you got something out of this today, then Headspace Geelong is here for you as well. So thanks very much, everyone. That worked okay. I think it went all right. It was an hour and a quarter, spot on. Thanks very much, and stay safe, stay well, and we absolutely are all in this together. Take care, everyone. Thank you.